Pima County wants to get the word out about an ongoing outbreak of hepatitis A, a viral disease that affects the liver and can take months to recover from. So far this year, the county has confirmed more than 220 cases, including 3 that turned deadly. It's a sharp rise from the dozen or so cases that it typically tracks annually. We learned about the county's response from Paula Mandel, a deputy director of the Pima County Health Department. She began with how Hep A spreads.
They've been in contact with either an object or a food or someone who is infected with the virus, and they have touched something, you've picked it up, and it's an oral route, so it's fecal oral. So someone has the disease, they go to the bathroom, they don't wash their hands, they touch the door, they touch food, they hand you the food, they prepare food for you, and then you are exposed. So it's on your hands, you touch your mouth, and then you become infected.
There's an outbreak currently in Arizona, but also in 20+ states throughout the U.S. How serious is this?
So we've seen an increase in the number of hepatitis cases across the nation since 2016. There are several states that have had an outbreak for more than 2 years. We started seeing our numbers increase in November of last year. So we're almost a year into this outbreak, and that's concerning for us. We have been trying to help protect those that are at risk and our community, but we are only at about 60% vaccination rate, so we still have a lot of work to do.
There are some reports that draw a connection between opiate use as well. Can you explain how that can be connected?
So what we've seen here in Pima County, we've identified 2 high-risk populations since November. Those who are experiencing homelessness and those that are using illicit substances, and also a combination of both. And so those are the 2 populations that we're focusing our vaccination efforts on. When you think about it, those are 2 very vulnerable populations. So they are not engaging with the rest of the community. They're living on the street. They don't have access to running water, to soap, really to bathroom facilities. And so when you have those issues with less than sanitary conditions, then you can be at risk.
What are some of the ways that it could spread from the homeless population to a more general population of people?
We have cases that are identified, and especially with those homeless individuals, we do a thorough investigation. So our epidemiologists are asking questions. If they've gone into, say, a grocery store and they've used the bathroom at a grocery store, again, our team is going in, talking with the people within the stores to make sure that they're cleaning appropriately and that they're using the right cleaning solutions to help protect their customers.
At what point will we in Arizona be considered safe, or it's over?
Right. What most people are looking at when they decide to declare an outbreak over is you've reached herd immunity, which is usually around 97% of the population in a community is vaccinated, and you start to see the numbers fall. So we go back to what would be considered normal, maybe 1 or 2 cases in a year. Right now, we have not reached that.
Now, is the vaccine something that we all tend to get, we just forget about?
Hepatitis A vaccine is something that really wasn't offered to us until 1996. Children are recommended to get the vaccine at 12 months to 23 months of age. It's not a required vaccine, so parents have the option to choose whether to vaccinate their child or not vaccinate their child. Hopefully, most children are protected because their parents make that choice. But adults that are, say, maybe over the age of 22 years, may not have been vaccinated. Possibly if you've traveled to a foreign country where hepatitis A is an issue or a concern, you might have been vaccinated. Or maybe you're one of those adults who choose to make sure that your vaccine status is up to date. You may have been offered the vaccine and you may have chose to be vaccinated.
If somebody wants to get the vaccine, they make an appointment with their primary, or do you get it at Walgreens?
Well, there's lots of options. They can check with their primary care provider. Vaccine is offered at urgent care centers, at Walgreens, CVS's, and then there's always the health department.
Paula Mandel from Pima County Health Department, thank you.
You're welcome.